is just a huge honor for me today to be podcast interviewing Michael T. Varallo, DMD. He's the founder of the Nantucket Dental Society and HoHoKus Dental Associates in 1982, where he currently practices full-time. His management approach at HoHoKus Dental focuses on patient's perspective and care. Since implementing his patient-focused business plan in 2000, Dr. Varallo's business practice has more than doubled in gross revenues. Dr. Varallo is both fundamental and innovative in his practice and is one of the first non-prosthodontists in the United States trained to restore implants. As founder of Nantucket Dental Society, Dr. Varallo is a strong proponent of continuing education and is dedicated to the realization that we are in the golden age of dentistry. His workshops focus on the simple but proven procedures which benefit the everyday dental practice. Dr. Varallo has been named as one of New Jersey's top dentists by New Jersey Monthly Magazine in 2009 and 14, and he is a graduate of Farley Dickinson University. So it's Varallo, right? Varallo?
Yes, sir.
So, Dr.
Yes, sir.
Varallo, how if you could wave a magic wand, would you bring Farley Dickinson back to school? We lost 10 dental schools this century. 1909, we lost the Pennsylvania College of Dental Surgery in Philadelphia. 26, we lost Ohio College of Dental Surgery in Cincinnati. 67, it was St. Louis University in St. Louis. 86, we lost Oral Roberts in Tulsa. 88, we lost Emory in Atlanta. 1990, we lost your dental school, Farley Dickinson in Rutherford, New Jersey. 90, we lost Georgetown in Washington, D.C. 91 was Washington and St. Louis. 93, Loyola, Chicago. 2001, Northwestern and Evanston, Missouri. What does it feel like when your dental school passes away?
Well, it was interesting. That was typical politics in New Jersey. There were two schools here, and Rutgers is now the name of the school. It was College of Medicine and Dentistry. And the funding, they didn't want to give either or, and that's how Farley Dickinson, the private university, lost out. The year I graduated, we were third best in the country in numbers. I think USC was in front of us, and same thing. And I was actually accepted at Georgetown too, which closed too. So my dad was a Georgetown graduate.
In Washington, D.C.?
Yes, sir.
So now, but they have Howard University. That's in D.C.
Yes. And now, I mean, we have probably, I don't know if it's 10 total new ones open, but you have, Arizona has a new one. Utah has a new one. Florida has 2 or 3. So there's, some new ones opening up.
So, how long have you been practicing dentistry?
Since 1980, 39 years.
So 39 years. So somebody's listening to you right now, and she just graduated from dental kindergarten school an hour ago. In 4 decades, how has it changed? And how do you think it's going to change for her in the next 4 decades?
That's a fine question. First of all, the technology is so much greater. The materials that we have, the diagnostic materials, the digital things. I've been digital since 99. So, all those things are wonderful. But the main constant is patient relationship. The probably best way to know your patient is through a detailed medical history. And through all the technology, all the things, if you can do a detailed medical history, you will be successful in this field forever.
So that's why they always say the more things change, the more they stay the same, because you're still a human. You might have gone from smoke signals to a telegraph to a telephone, the internet, but you're still the human. I mean, it's relationship. At the bottom line, it's still a relationship.
And break it down to dentistry. We were taught prevention. Remember, they told us we were going to go out of business. You're going to make sure that we're finished, because of the progression. However, we're still in the same business now, prevention. And it may not just be for teeth. We accept patients. We're clearing patients for the Tarvar valve for Valley Heart in Ridgewood, New Jersey. We're also taking the patients from Sloan Kettering before they enter treatments, for their cancer therapy. So it's prevention again, maybe a larger scope, but it's still prevention. It's still the same way that we should be the crusaders for our industry.
So do you think dentistry is going in the right way? I mean, when we started, it was gold crowns and gold fillings and amalgams, and now we replaced all this stuff with these plastic composites. I mean, do you think that was moving forward in dentistry to replace all the gold and amalgams with inert plastic composite? Was that a positive step for dentistry? I mean, I know they're pretty, but as a bald dentist,
and you were one of the foremost guys bringing pretty to dentistry. So really, it's what the consumer wants in that. So there's a lot of, we can tell people what they can have, but it's also what they want. I mean, you could not put a gold tooth in tooth number 29 today. Nobody would tolerate it. Probably tooth number 15 or 2 would be difficult. So, do I think there's advancements? I think, with every advancement, we fall short of a few steps. And I think the cementation during the first couple of years with zirconia were, some issues. But I think overall, I think the quality of dentistry is better than it was 30 years ago. I really do.
And where do you see the changes right now? I mean, what's got you most passionate right now of changes today as we're coming up onto 2020, which next year we should see really, really clearly because it'll be 2020.
For me, I've been on the oral systemic connection a while. And what I see is the interdisciplinary medicine switching around. I'm both on the staff at Valley Hospital for sleep medicine, and I'm on the advisory board at the Nantucket Cottage Hospital to help with the clinicians and figure out how we're going to do things. So this is a dentist, figuring out. We got a call yesterday, the day before, from a hematologist at Valley, said, you know what? There's a new study. The study says P. gingivalis is associated with rheumatoid arthritis. So it's changed when I started, I would call for permission. Today, if you know what you're doing, they're calling you for advice. And it's a nice progression, and I think we will be part of the mainstay health, much greater respected than we were 10 years ago, 15 years ago. So I think it's kind of cool.
When I read about the oral systemic health, I can't, the first thing that makes me cringe is what percent of all the dentists after every extraction just give Pen VK 500 milligrams and after everything. And I say, well, what was that for? I mean, did they have a systemic infection? So, just CYA. I give that. It's like, do you think, what percent of dentists do you think are overprescribing antibiotics?
Lots, and also opioids too. So we'll do both. And the answer is tremendous. We stopped writing prescriptions for any opioid 8 years ago. So
really?
I said,
8 years ago?
And we helped St. Joe's in hospital. I haven't written a prescription. We took a pain management course at Tufts. 4 Advil, 2 extra strength Tylenol works faster, longer at the site and the brain perception of pain than any narcotic on the arm. So why would I do it? There's no evidence based.
But I'm asking you because this is Dentistry Uncensored. What percent of general dentists do you think after every extraction and every molar root canal just give them Pen VK and Vicodin?
At least 50%, 40%.
Yeah.
And oral surgeons higher on the Vicodin. And the same thing, general script. Now, also the prosthetic for pre-medication for hip. The ADA and the Prosthetic Association said it is now up to the orthopedist if they want to prescribe. So the dentist shouldn't even prescribe, not legally allowed to prescribe to pre-med for artificial joints.
So what are you focusing most on oral systemic? Is it mostly sleep or where?
I agree. I got a stat here, but there is 259 million Americans. 100 million are diabetic or pre-diabetic. So you have at least 30% there. Now, add another 30% that have some sort of heart disease. Add another 30% Alzheimer's. 30% of Alzheimer's patients have the spirochete from your mouth in their brain. So now take that, add to cancer patients. University of Jerusalem had infertility linked to the inflammation. So anything that ties to inflammation from anywhere in the body is tied from, that's the most common inflammation in adults is gingivitis and periodontal disease.
And Go ahead.
when you say focus on it, there's what dentists don't see is that in those numbers, if you see 10 people in a day, if there's 30 in a week, there's going to be 10 diabetics. There's going to be 5 heart. So when you educate those people, they become patients for life.
And where are you getting most of your oral systemic information from, or what? Because you started, you were the founder of the American Academy of Sports Dentistry. I mean, my God, that is the Academy for Sports Dentistry.org. Talk about
still in there. It's still working.
Yeah. Well, we'll talk about your journey there with Academy for Sports Dentistry. What made you start that back in the day?
Well, I played on a state championship football team. So, and my fraternity brother at college was captain of the Jets, became captain of the Jets. So when I was in dental school, I went out and met the docs that were out there. So they said there. So then the Giants were here and the Jets were here, and they both had, their dentists. So Hugh Gardy, God bless his soul, called me one day, and then the Devils called me to be their team dentist, and just followed through. Something I've done for life. I give, through the years, we make free mouthpieces, and they're custom, beautiful mouthpieces for thousands of athletes, pro to 5-year-old kids, always free.
And Eric Jackson sits on the board of the Academy for Sports Dentistry. We've had him on the show. What does everybody need to know about the Academy for Sports Dentistry today?
Well, again, they'll do what are trauma issues, how to replace teeth, how to do that. But really, it's the advancement of science in with the mouthpieces. What can we do? How can we do it? And how can we propagate it? There's probably there's more deaths in baseball than there is in football. And that's what that science led to the electric, for your heart to start your valve. So again, we push it out. It's really a prevention organization. From when I started, now all the major league teams, major league baseball teams and football teams have oral cancer screenings, have oral periodontal screenings before they sign contracts, before they go into practice.
So what would be the Academy for Sports Dentistry that you established back in 1983? What would that be for the oral systemic link?
Well, that became later on, is that I started to do this as in, I had a professor of oral med, Abe Chasins, God rest his soul too. And, he just piqued my interest. We started doing this. I became the first group of evidence-based dentists in the United States selected by the ADA. So when we start to pound this data, the connections, Poe in 1990 declared with the science that diabetes and periodontal disease are bidirectional diseases. The other diseases I mentioned are associated with, but they're bidirectional diseases. So go back to my education, we were taught prevention, prevents tooth decay, prevents. Now all of a sudden, if your H1C comes down, if you have less periodontal disease and your gums are in better shape, and it's a bidirectional disease, so you can help the diabetic every day. So that's how it started, really, with diabetes. And then as the literature progressed, and if you want to go on PubMed, and it's public for everybody, there's plenty of data for heart disease. But the coolest part for practicing dentists, I do that whole consult in about 4 minutes, and I tell every patient, the caveat is, if I'm wrong, if all this literature up to today is not conclusive, what's the downside? Clean teeth. There is no downside to this connection. So all the dentists who fought it and don't want to hear and say it's not science, but there's no downside. If we keep this clean, you have a healthier body, period. It's easy.
So when did the term bidirectional, you called it a bidirectional relationship. When does that terminology been taken?
I think that came in the 90s with the investigator Poe, and they developed that was if you took the periodontal disease, brought it down, that the A1Cs would come down, and vice versa. If your sugar started going out, your gingiva would be. So that PO became a bidirectional disease.
So, when I was in school, they would always talk about how when they started figuring out genetics and family trees, they'd say, you know what, on these autoimmune diseases, if you can really fill out the tree long enough, if you have one person with one, they'll have another. Like if you have someone with type 1 diabetes in that family tree, there should be a celiac sprue, a rheumatoid arthritis, a thyroid disease, multiple sclerosis. So what do you think is at the Sjogren's syndrome? So what do you think is at the core of these autoimmune disorders, and how does that relate to dentistry?
Well, super is that interleukin 1 and interleukin 6 are identified inflammation genes. So if you have those genes, you're more subject to all types of inflammation. And if you're subject to all types of inflammation, I believe, and the ADA reps of last year, the keynote speakers, Bale and Doneen, it's 15 times greater to have a heart attack if you have that gene and have periodontal disease. So that turns where they came with the hot blood. But it's really a genetic basis that would bring it all down. And probably when I said Alzheimer's or heart disease, as you said, if that was your defect in your genetic makeup, then that's where the inflammatory is going to peak. However, if you have inflammation in your mouth and it doesn't stay there because it travels to the liver, and interleukin 1, interleukin 6, and prostaglandin 1, and they all start to get released, the body doesn't know it's just the mouth. And that's where the inflammatory response comes.
But again, though, I'm trying, 25% of the people listen to my podcast, they're still in dental school. And the rest are all under 30. Where would she join to learn more about this? Is there, like, if you to say, what's the one organization where they're going to learn the most about the oral systemic link? Where would you point them? Would it be a book, a website, an organization?
That's a good question. I PubMed for your individual knowledge, and I believe each school has had a bigger play in oral med. I can't tell you that each department. I deal with Tufts a lot in their oral pathology department, but something, it's a good question. I'm going to find out. I'll get back to you on that.
So, what do you think about we talked about opioids? Well, that's Dentistry Uncensored. Let's talk about the other one. Marijuana was illegal most of our entire lives. And
it was? No, I'm sorry.
And now it's legal. What do you think of that? Do you think that's going to have a dental relationship? There's a lot of anesthesiologists saying they don't, they feel pain differently. It's hard to put them to sleep. What do you think about the medical marijuana?
Forget that. Let's go to teeth for a moment. The marijuana smoke, the people who do smoke, the smoke itself is hotter than cigarette smoke. So that actually reduces the blood flow to all the gingiva and all that. So you see much more dry mouth, decay, and throughout for people who smoke marijuana. As far as it's a very interesting topic. You asked about data, and again, I'm an evidence-based dentist. There is no real research on all of that on marijuana. So how do we, except for money, how do we decide we would legalize a drug in the midst of a drug crisis without true data? No double-blind studies on any of what you just said. So it's right now up in the air. It's wild, wild west.
And the other thing, wild, wild west, I mean, when I was little and I was still in dental school, I mean, the vaccines were the heroes of the 21st century. I mean, polio, all these vaccines.
We took it on a sugar cube, if you remember.
Yeah, and the scientists tested on themselves first.
Yeah.
I mean, it's just crazy times. And now here we are. It's 2020 almost, and HPV vaccines. What percent of dental offices do you think discuss the HPV vaccine and try to get their patients to take it, which, to reduce oral cancer and all that kind of stuff? Or they...
In New Jersey, actually, they passed a bill that here we should have some, and then the patients at a certain grade level. We actually And there's still the research out on it, but you can genetically test to see if you have HPV on an oral rinse.
And but what percent of dentists do you think are talking about this?
2%, 3%.
Yeah. So
and then you get back to the imaginary dental student, is that these are the things we need to be able to get in a concise to. Everybody thinks about marketing and how we can do the dental marketing, and boy, you've done such a wonderful job. But if you're going to separate yourself in an industry, you need to be able to, if you can do this, this is far greater. When 2008 occurred, the recession, dentistry stopped spending money, and it didn't return to 2016. In those years, I did not have any growth, but we did not have a down year. They were up 1%, down 1%, up 1%. So we were flat. So in all my colleagues, and nobody understood that because everybody else was down. And I think it was because if you made sure that the oral systemic connection, if you educated each patient, they would want to take care of their health. And that's another thing, dental school actually we become the owners of all this. And people say, oh, my patients don't do the hygiene. I implore partnership, because you can't win without a partner. I can fix your teeth. Teeth are easy today. I have so many cool things, CBT scans. We got sinus. I can do all this. I can't fix your gums without you doing it. So I implore the partnership to the patient. So for young people, instead of you owning it, you need to really reach to them and say, I need you to help me fix this.
Gosh, we talk about Gardasil. I mean, you started off this podcast talking about prevention, and I just can't think of anything worse than a patient dying of oral cancer that was under your care, and that they came in, they saw you every 6 months from, birth to whatever, and the conversation never came up. Why do you think Gardasil, which is owned by Merck, why do you think they aren't really changing the behavior of dentists?
Oh, yeah. The behavior of dentists themselves, if you took an ADA survey, if you took the survey of dentists, 65-70% said I did an oral cancer exam. When you took the perception of the patients, 10% said they had an oral cancer exam. So the communication, whether they're doing it or not, what happens is now in how we do a regular exam is the hygienist is going to look first, and they do a full intra and extra oral. We take photos. What is really cool, and I use Tufts a lot because I don't always biopsy something, but I know them well enough that I'll take a picture and send it up. So we have diagnosed oral cancer. We do that, but you're right. The young people got to really turn to do that. The reason cancers always have a marquee guy, and marquee cancers, colon cancer was Ronald Reagan. He waved out the window when he got his polyp out. Alcoholism, Betty Ford, shaking her hand, and we're going to be okay. So breast cancer with any of the actresses that did, all these people, we don't have a marquee person to really say that was. Michael Douglas was diagnosed by a dentist in Canada, I believe, and it was a throat cancer. And I thought he would be the guy. It turned out nobody wants to talk about it. So the dentists don't gravitate to that and then don't tell their patients. We, on the other hand, have handouts what oral cancer is. We use a Velscope. I don't know if you know Dave Pearson. You know Dave?
Dave Pearson? Name sounds very familiar.
Yeah, he does a lot of the background stuff for, a lot of the companies. But anyways, I helped them launch, the Velscope when we first put it out. And, we've done very well. And we'll take photos and send it to the ENTs. We send it to Tufts. So again, it's an interactive thing, but it's also the right thing to do, but it's also good for business.
Yeah, but my, dentists tell me they say things like, well, Howard, physicians have a private room and I have an open operatory and this is a very private conversation and I'm not going to bring up because it's related to sex, it's sexually transmitted. I mean, what would you say to a dentist like that's afraid to talk about it?
Well, first of all, it's not just sexually transmitted. HPV could be transmitted in other ways too. That's maybe the largest. And vaginally, and if you have sex with 6 partners or more, your chances increase greatly. However, all of this is that you would rather have that discussion than tell them afterwards that somebody else found the oral cancer. Physicians don't look in the mouth. Nobody's going to do that. So when you brush biopsy, when you photo it, you can have the conversation privately, but you have to educate the person. Where you have it can be different but you got to be telling them, look, by the time we're done with an exam, the patient takes their tongue and sticks it out because I'm going to grab it with a gauze. I don't have to tell anybody anymore unless they're the new people. And I'm going to forget her name, but she would come to different areas to show how to do an oral exam. She came to Nantucket for us one year, and we had handouts and gave it to dentists. They think it takes too much time. I don't think so.
Yeah. So what else has got you really excited these days? What are you most passionate about? What makes you still run 20 red lights on the way to work?
Well, I got a 4-minute commute, so it's easy. But I was here at 6:30 this morning, and I start 3 days a week at 6:30. I'm 66, and I start one day at 7:30. I'm here till 6 o'clock a couple nights. So what makes me tick? Headaches, probably the most underdiagnosed and undertreated in America. Oral cancers, the sleep, and underdiagnosed, billions of people going through this. So the future is just exciting for people who want to embrace that rather than tooth carpentry. It's exciting.
And why do you think you have that and others are burned out and fried? I mean, you've watched a lot of dentists come and go in 40 years. Why do you think you still want to get to the office at 6:30 in the morning and there's another dentist who just wants to, he just can't wait till it's over. He wants to quit.
I think, honestly, the tooth carpentry and the guy, let me tell you something. When I got a call from a hematologist at the hospital I didn't know to ask me about a patient and to see if the CAT scan was something on a tooth, and the autoimmune system could have been kicked off by these. She has failing root canals anyway. That was enough for the day. I have diagnosed oral cancer on a spot. We saved somebody's life. Every day that conversation goes, it's kind of fun. I mean, it's not drilling and filling and trying to make money. I also do take a lot of time off. I've always taken a lot of time off from the beginning. It's a Manhattan-based style, even though I'm in New York, in HoHoKus, New Jersey. And I always took a lot of time. I spent a lot of time with my family. It's a well-balanced operation. I do have a house in Nantucket. I have 4 grandkids. They all see us. They do us. So I never thought I had to run in and work 100 hours a week and stuff all the money away and do all that. It was a slow progression. And I have a well-balanced life. I, married to the same individual for 43 years. So kind of balanced. You need to balance it. And it's a crazy job we have.
So she's scared. She came out of school. She's $284,000 in debt. And she's looking at us 2 old guys thinking, you guys are lucky. You graduated back in the golden years. And it was before, whatever. What would you say to a 25-year-old, $250,000 in student loan debts, who's wondering if maybe being a dentist was a bad idea?
Well, I don't know if we put this down for you. I run an internship, post-grad, all into dental school on their first application. So we do have that conversation. And the Tufts graduate who came out probably owes closer to $500,000. So what I told you is that I think with us as a profession increasing upon the healthcare industry, medicine is in disarray. Very few guys own their own practice anymore. Women have, big groups, only hospital owned. So there's an avenue for us to take advantage. We don't reach out to individuals. We need to educate the populace. If everybody showed up in Bergen County, New Jersey, which is a very wealthy county, to go to the dentist tomorrow, there isn't enough chairs here. So you're not in competition with another dentist. You're in competition with Amazon and vacations. You need to show the value. If you do this, you can live like this. MedOz gives you 6 extra years of life. 6 extra years, which is a handout we give if you floss every day and get rid of your periodontal. 6 extra years. Not a single thing is double that.
When she comes out of school, she basically just, if you look at the requirements, they only did a dozen crowns, a dozen fillings, a dozen extractions. And she's looking at all these things she wants to learn, but, she wants there to be a return on investment. There's dentures, TMJs, sports, Botox, implants, perio, root canals, Invisalign. She's got to start somewhere. Where do you think is the best place to start walking up the stairways? You're up there on the 2nd floor in the loft, and she's got to walk each one of those steps up over the next decade. What would be her first couple of steps for you? Would it be implants, Invisalign, TMJ?
Well, for the dentistry, I go back to that medical history. So when you want everybody who comes in that you see if we're in the production modes and I worked in a clinic when I first got out to produce. So that's a different story. But if you're going to be in a private practice, really what you want to do is the medical history. And you build that relationship. Then the bread and butter dentistry, then it comes, we can do implants. They're well more versed in implants than we were when Lenny Linkout was placing them in the day. So they need to overcome that. They have a cool thing that we don't think of. They have you and YouTube. A band broke off. One of my young associates looked it up. How do I push this band back on? And YouTube did in 30 seconds, and he did it. So there's plenty of advancements. And I think the bread and butter dentistry, which brings a lot of people to the table, is really what you need.
And you have associates working for you. When you look at DSOs, their number one problem is they can't keep dental associates. If you're a DSO and you got 500 locations on any given day, you got a dozen dental offices that don't even have a dentist. First of all, what do you think of the DSOs? Because you've lived through Orthodontic Centers of America, and there was a dozen. You and I have lived through a dozen of these things that made it to an IPO and then failed.
Remember Bernie Fink?
Bernie what?
Bernie Fink, Garden State Dental.
Yeah, Bernie Fink. Which one was he with?
Garden State Dental, I believe. Yeah, he was the orthodontist. He's a friend of mine. So I do live with it. So DSOs are, if you look on TV right now, Clear Choice and I'll pull a senior moment on it. Clear Choice and Aspen are competing in the advertisement, not for the same patient, but they're advertising. Do I think that's wonderful for the GP? Now, Heartland says the GP will take 2 years to get up after school, what you said, to get up to be able to produce, to make money for Heartland. They've done a study and they can crunch the numbers. So what happens is if you can get a good mentor, I think that could be done in 6-8 months. Maybe not every aspect, but you can start to do it.
And what did Bernie Fink, Garden State Dental, tell that story? Was that one of the original DSOs or what?
Yes, I really believe. I think it could have been the original. One of the first regional operation. He was an orthodontist in Maryland, and he would lecture all over and put everybody, and then put general dentists and orthodontists, put everybody together. I don't know what the total number was, but I think way back when it was like $30 million.
Oh,
so
wow.
The new DSO is different. The new DSO's formula is to buy somebody like me out and keep me in place and not let anybody know in the community that it's a Heartland or an Aspen or a Clear Choice. And Clear Choice is all on four, and you know that they're killing it. They're doing lots and lots of dentistry.
Yeah. So what does Bernie Fink think of these modern day DSOs? Does he think they finally figured out? Do you think they got a business model that's sustainable? Does he think they're doing well now since he was doing this originally?
Yeah, they've expanded. there's more people, there's more players in the game. I talk to more of the group, more of that. Everybody has a little different formula. Some really want the 1 or 2 man practice and then expand it. Some want the 10 or 12 group orthodontic, endodontic practice and then expand it. But for a couple guys in the industry, they would classify it as a baseball game in the 4th or 5th inning. They're not really just beginning. They're starting to take more over. And that adds back to, we're talking about our graduate there. Only 48% of the people graduating want to own their own practice. And half of those may not be able to afford it. So that makes the DSO become maybe the purchaser for larger practices and maybe the hiring for that younger associate.
Well, they've always been about liquidity. I mean, the first one, the only one that made it on the New York Stock Exchange, Orthodontic Centers of America, and he saw that the only orthodontic practices that could sell were about 750,000 to $1 million, and there were all these monsters doing 2 to 3 to 4 million. So he just went out and got $100 million line of credit, and all those orthodontists sold to him because no one else could buy. So they all started with about just liquidity, but nowadays, as you say, half the dentists don't want to own their own dental office. That wasn't like that when you were in dental school, was it? So what changed? Why is it the millennials? Is it that half the class is girls? Is it because they like yoga? I mean, why is it? I mean, is it a more balanced lifestyle where they look at you and how hard you work?
No, it was good. I think that is one of them. I think the other is that even teachers and cops, police officers and those pension jobs, security became much more important than, as the country got wealthier, than the entrepreneur. We didn't consider ourselves, and for sure you're the epitome of what an entrepreneur is. We didn't think of ourselves as that. We didn't think of ourselves. We thought of, okay, you had a job. 83% of the dentists in the United States only visit their practice ever. They don't go to other practices to see what's going on. So when we got boxed in, larger fish started to figure out, if you took my office and cut the supply bill down and cut what we do for all our employees, you can make 10% on your money as it is. The formula was the physicians. Hospitals bill more than physicians. So they bought them and made 10% on their money. So that's where we are. And I'm not sure that's good or bad. It is just the reality of the base where it is.
So is your dental office in Nantucket? I mean, you're the founder of the Nantucket Dental Society. That's an island, isn't it?
Yes, sir. It's an island off of Massachusetts. No, I have a house there. I do. I've summered there. My kids grew up there. We do that. I live in New Jersey. My office is in HoHoKus, New Jersey. Really, the beginning, do you know Lou Graham?
The dentist or the singer?
Both. Actually, the dentist.
Oh, yes. I love Lou Graham. He's been on the show.
Lou's a good friend of mine. Lou's a good friend of mine. So Lou said, I want to lecture in Nantucket. I said, well, I could do that. So Ora Farmer sponsored us. And about 30 grand later, I realized I wasn't as smart as I thought I was. So he was the first speaker. And, then I started using the people that I'm both friendly with and how we got associated with, all those people. I mean, Ron Jackson's been there 3 times. LVI comes out a lot.
So how do you get to Nantucket? First of all, how long does it take you to drive to the beach closest to Nantucket? I mean, you got to go up, the 95?
Where are you coming from?
Well, I mean, your dental office.
I'm coming from my dental office?
HoHoKus, New Jersey.
I fly.
Commercial? I mean, just a little 2-seater?
No, not me fly. I have a pilot. Pilots fly. Yes.
Yeah.
No, I do actually. I helped found an airline that flies out of Teterboro, New Jersey, but you can fly from JFK. You can fly from Newark.
And what made you, that's a long way from where you're at in HoHoKus, New Jersey. So what made you think of doing this in Nantucket?
Well, in 1980, when I graduated, we went to the Cape. I had always been a Jersey Shore guy. So my wife and I said, all right, let's go. And we decided to go up to the Cape. We went to Martha's Vineyard, Nantucket, stepped a foot on the island, and we both fell in love with it. And then in another difficult place that I was at a lecture in St. Bart's, Lou called me over and said, would you do this? Maybe we'll talk about Catapult. Would you? He said, I'd love to come to Nantucket. So that's how it started, as a conversation with Lou Graham and myself.
And the next island over is Martha's Vineyard, right?
Yes, sir.
I mean, that is just some amazing. So I'm going to switch to another question I think you would handle well. A lot of dentists tell me when you say, you go rural. I mean, why do you want to go in downtown Boston when there's, 13% of the towns and the Midwest don't even have a dentist, but they're all in population smaller towns. A lot of people say, I don't want to go to a small town because everybody knows your stuff, and the other dentists, they feel weird about it. You have a dental society. Dentists have big egos, like physicians and lawyers. How do you keep bigger? How do you? What advice do you have with these young dentists? They want to join their local dental society, and there's just how do you keep the peace with the Nantucket Dental Society with all these big doctor egos?
It's funny. The people who lecture, as you've seen, are the top guys in the world. So when they come there, people sit and listen, and they respected the outcomes. I didn't bring just guys to have a boondoggle. These are really educational days. Plus, we have a really, really good cocktail hour and bar. I mean, so that keeps everybody in line too. Dennis, a few drinks, everybody's a little happier. And we have a clam bake, so it's kind of fun. But it's not a membership society per se. It is sanctioned by the ADA. I'm to the best of my knowledge, one of the single CERT providers in the country. So we're a CERT provider. And
another thing I always see with doctors that are a cut above the rest, they have hospital relationships. What was going on in your journey where you wanted to go get involved with your local hospital?
Well, interesting, in my local hospital, we had a staff. So, and this is back in 1980. So when I became first of all, my father was an oral surgeon. He died when I was young. He was chief of oral surgery at St. Joe's in Patterson. So that was my hometown. That's probably back to the roots of the oral systemic things. So for me, it was a normal thing to be part of a hospital. Then the oral systemic, some groups that you join say, okay, good. And then Valley Hospital got rid of its dental department. Everybody else in the country's adding it. They get rid of it. So Nantucket asked me, the director asked me if I would help on the advisory board. And we're building a new hospital. So we put the advisory board in for the physicians there. So that's how. And then Valley came back and said, you've been doing sleep since the 70s. So would you come on our interdisciplinary board? So we entered it back. So it's that's a very important thing for today for the young people to get involved in their hospital associations.
Yeah, I want to talk about money. They come out of school, these student loans, and the dental marketing media convention make them believe that if you want to be a great dentist, you're going to have to buy a $150,000 CAD cam, $100,000 laser. You're going to have to buy all this stuff. What does she have to buy to be a good dentist?
Oh, I mean, you need digital x-ray. So that, that's a $30,000 thing, but that's minimum standard. And I think the opposite is that you really need a really good software, in your office, so that you can run both digital records. The next you can build as you go. I mean, I have biolasers. I have a lot of toys that actually now make money, but you start out, obviously, I don't think anybody takes film anymore, less 20% take film in the dental industry. So you would need and then a good software system.
Okay. Give her a name brand. You said digital x-rays, you said the software system. What did you use? What did you go with?
We're, EagleSoft is my, software. First of all, I don't think anyone, there's a couple and I can't tell you, but there's a couple coming online that are very good. And we have a CAD cam. We have Vodtech. is our things, and Gendex is our digital X-rays.
And Eaglesoft, that's in the same. That's in Effingham, Illinois. That's the same birthplace of Heartland. Those guys are in the town has only 10,000 people, and it spawned Eaglesoft and Heartland. I mean, they ought to rename the from Effingham to Dentalham. I mean, unbelievable.
Well, so, maybe you'll franchise the name out there. Give them a little, dental town. You can.
So, does the BioLace laser, is that boys and their toys, or is that really something that a dentist should consider?
100% consider.
Which one and why?
A class 6 restoration. A lot of dentists don't even know it's a stirred event class 6. Anything that involves the incisal edge. So I would not take any more rotary instruments to an incisal edge. So we have wear facets on the incisal edges that I can take a trough less than 1 millimeter wide and make it 2 millimeters deep and protect those incisal edges and make them look beautiful. We do class 5s. I wouldn't prepare tooth with a diamond. I had Brassler do a study. Brassler did a study that carbides produce more microfractures than diamonds, and diamonds produce less. BioLace produces none. My laser, hard tissue laser, I don't just want to say BioLace. So once you use it, and then in my office, because New Jersey is a little backward, we don't allow hygienists to use a laser. So we don't use it as much as perio. As out of state, you can use that as perio. So then you have a dual action for it. I would do the refractory cases when they can't fix them. I tend to take them and use the BioLace with our radial firing tips and the protocol that we've established. And when I got my first BioLace, there was no manual, so I had to help them write the manual.
Yeah. So, yeah, they're having a BioLace. They're having their meeting. They're going to have a really cool meeting in San Diego. I love San Diego. It's October 18, 19. When you live in Phoenix, you need zero excuses to go to San Diego. In fact, half my team wants to just move to San Diego. So again, I want to go more to technology because it's so darn expensive. What about cone beam technology? I mean, she just got out of dental school. She bought her practice. She bought her mom's dental practice. She's got digital radiographs, but she's got a pano machine. Do you think you really spring for a cone beam?
No, not right away. Again, the cone beam becomes in, do I need where I'm going to place an implant? And again, in those areas, if you're going to do the surgery yourself, you may consider, but there are places you can actually ask for images. If you built another relationship, if you needed that, we make 3D models, we ship them out to the lab. At the beginning, I'm not quite sure. Our Vodtech machine's in the $100,000 range. It's the greenest machine on the planet, the least radiation, and the software is a continued upgrade, so we don't pay for that. Whereas some of the others, that's a problem when they all wind up softwaring themselves out, and each time you have to upgrade. And I used to I scanned the first modelless crown in the United States. We uploaded the thing to a laboratory in Florida and had it sent back in 2 days. So I didn't touch it. We did it. It was through 3M. I don't even scan now. And because I didn't like the way everybody wanted to proprietize their own format and not share the platform. It's much more open now in the last 6 months to a year, and hopefully it'll open more, but nobody wanted to share the platform. I couldn't send it here, couldn't send it there, so I had issues with even technology itself.
But you do like the BioLace, though.
I use it every day. That's the only piece of equipment, and I'll beg that at one time I was a key opinion leader for them. I don't do a lot of that much for them. It is the one piece of equipment that if it's never been down, and I'm 2001, 2, whatever the first one's out, I'm a long time generation, that I would cancel. I would not do a class 6 or a class 5 restoration on a handpiece.
Wow. Any other technology that you like?
Yeah, I mean, we do have. You said no, and I don't want to entice anybody, but with the CBT scans, I mean, now we upload those to the laboratory, and they can make a stent for my oral surgeon. I can now upload. We do when we talk about oral systemic, we use beam readers, and they'll upload my scan, and they tell me every pathological thing that's wrong in that scan. So from pineal glands to carotid artery calcifications so we kind of use that a lot, both for our sleep because it measures airways. So even though I told them not to get that because that may not be the focus and you can get out to that. But I mean, zirconia crowns, for the posterior, I'm almost doing all zirconia. Nothing in the aesthetic zone.
So now that you talk about zirconia, and that's another thing, she has these student loans. She just bought a practice, and she's looking at her Crown and Bridge lab, and she sees labs, low-cost labs like Glidewell to high-cost labs. What should she be thinking about? Because she's thinking, wouldn't I save a lot of money if I switched to Glidewell? Talk about labs.
I use a master lab technician, and I always have, because the least amount of makeovers, the least amount of things that you have to do, the least that you have to go through, you'll make more money in the end. China, there are some traces of lead in some of their crowns. So I don't do that. I never did it, but I don't do that with materials either. When we use implant, we're a Straumann implant. And again, I was a key opinion leader for them. So I get that out for you. But I don't need their knockoff because my success rate's in 97%. So in any of these things, use the best, and the least that you need to touch it is the best. In probably 95%, when I used to lecture for 3M, 95% of the crowns, we take the temporary off to place it on, and they fit perfectly. Fit in occlusion. I make them a little tighter than normal, so that would be the 5% because I don't want any food getting caught. But other than that, it's a master lab technician. Do I pay a little more? Yes, I do. But that chair time is valuable.
See, in my view on guys like Michael is that whenever you meet a guy like Michael, the one thing all the successful people have in common, they all got into continuing education. I mean, he's to the point where he started the Nantucket Dental Society. So you have these kids come out of school and they say, Michael, I just did 8 years of college. I don't want to do CE. I don't have time for that stuff. I need to drill, fill, and bill. How important do you think dental continuing education is over a 40-year career to keep you happy and productive?
Well, happy wanted to. And I would tell you I had a great dental education. I learned nothing in dental school, meaning we learned technical stuff, but not really how to interrelation with the people and how to do it and how to sit. And what I told you is that dentists, we trained, and I always obsessed with the word trained because that's what we did. But really, we're doctors. Should be educated. So when we were trained in the cubicle in the dental school, all right, we never got out to see what the rest of the world was. What an educational experience should be, not just to learn, but to see what other people do and where your comfort level is. Never be happy with your comfort level. Never. If you look at the CEOs of the world, Howard Schultz said, if you come to my first 15 minutes of a meeting, we're making money. If you miss the first 15 minutes, you think we're going out of business. How do I get better? What do I need? How do I do this? And you can't do that in a cubicle. You got to get out. You got to see it. You got to be enticed. I mean, you saw it last year, Michael Gelb comes. I knew Harold. I knew his dad. So Michael comes in, gives me the big hug. We didn't really, we had a mutual cases a couple over the years. But, Mike, what am I doing wrong? He said, no, what am I doing wrong? You're doing this, we're doing that. So the sharing of ideas is it's not the learning itself, but learning of what surrounds you and where you swim in the water. I really believe that.
So one of the biggest changes in our careers is that when we got out of school, we just billed Delta and they paid 100% for clean exam and x-rays, 80% of our root canal and filling fees and half on crowns. Now that's reversed. They send you the fee schedule. Do you think that's a race to the bottom over time? I mean, do you think that's just because they're not going to give you more money, but inflation's going to keep going up and up and up? Do you think being insurance dependent is the biggest threat to dentistry, or do you think it's DSOs and corporate dentistry? What's a bigger threat, insurance or corporate dentistry?
The dentists themselves. And I'll tell you that is that inside 48% of the people who have Delta Dental don't go. So it's not whether dental didn't pay you, it's getting those 48% that don't use the benefit every year to come. What happens is, and we're thinking of taking actually a few more. We only take 2 dental insurances, and Delta is one of them. I've been a premier dental provider since 1980. So, I think in the transactions today, the way millennials they wanted to know exactly what it is. So when the dentists go and say, okay, good. Hey, by the way, this is going to cost you $1,000 and your insurance is going to cost you $50. Your bill's $950. I don't think if they had the value built in, that's the problem. 48% of the people don't go to the dentist, never mind Delta, once a year. So if 50% went twice a year, you'd be packed. So it's really us as the dentist and the individuals to develop that stream, that coerciveness. And I think the excitement helps too.
Well, I mean, but you're in America. In America, we never take personal responsibility. Everything is someone else's fault. I mean, we're all victims. I'm seriously thinking about suing my mother. I'm going to call my mom and say, so I loved it. I mean, I said, is it Delta? Is it corporate dentistry? And you said, no, it's the man in the mirror. That's bottom 100%. Line. And then one other thing, a lot of these young dentists, they come out and it's almost like they got out of a monastery, or they don't want to get associated with business. They say, I don't want to sell dentistry. I didn't go to 8 years of college to become a doctor to sell dentistry. I don't believe in that. What do you say to a young dentist who says, I don't want to sell dentistry. I don't want to be a business person. I want to be a sovereign profession of dental doctor.
Well, unfortunately, after 208, there is no more sovereignty left. So, and I don't, again, as you know, I'm positive. So what happens is, I don't think the terms, that's what happens and everybody has to sell. But really what you're doing is education. Maryland did a program about 2 years ago. And the more you educated the patient base, the better your patient base was. So we give handouts. I still use Casey, and we still present everything on the board. We still go through a consult with my assistants and pictures and notes before I walk in a room. The old Cy Sims, the educated consumer, is my friend. And that's really what you don't need to sell. People want, smile makeovers. People want, it's what they come in to do. So, and the other part is the people who don't, I'll tell you, for me, about 8 years ago, I had a patient have 12 laminates placed in Florida, not mine. And she came back and she was talking to me. She said, well, you never said you could. Because I didn't think you needed to sell. And the answer was, you don't need to sell. You need to say, I can do this. I can educate. I didn't love the idea of being, I'm the first guy in Jersey trained to do serenade laminates, which was, 100 years ago in between. I didn't want to sell that as cosmetic dentistry. I thought that was wait a minute. What's wrong with cosmetic? Everything I do is cosmetic. So as you start to round those edges and think of the high profile that you are, it's more important to educate your people and tell them what you can do. What's wrong with being the best you can be?
And last but not least, I have noticed that dentists aren't good employees. When I meet somebody who's been out of school 5 years, they've worked at 5 different dental offices. And they usually just keep bouncing from job to job to job until they get so rock bottom and so depressed they open their own.
I had a 45-year-old guy come in this morning the same way, a dentist. He said, hey, doc, he said, I'm Dr. K's friend. She said, I never bought a practice. Are you still looking for somebody? 45. So go ahead. I'm saying yes, you're right.
So what do you say to someone who just they change jobs every year as a dentist because they're too they just don't want to set up their own office? Do you think it's fear based that they're afraid to set up their own dental office? Even why do people quit their job every year and work for 5 different dentists in 5 years, as opposed to guys like us? I graduated May 11. I had my dental office open September 21. And that was only because the construction people, I got 5 bids, and like an idiot, I got the lowest bid. And so they worked about every 5th day. And
where'd you go to school?
Yeah. University of Missouri, Kansas City, UMKC in Kansas City. But looking back, I should have taken the highest bid, and I would have been open in 6 weeks. But what do you say to that person who just doesn't want to own their own practice?
Again, I think part of it, it's not that they even are afraid. It's their mentality that that's not the entrepreneur that needs to be. When we were there, the entrepreneur was you would gravitate towards being a physician. You would be independent. You'd be a professional. Now guys really grow up and say, but it's the same in corporate America. We're losing that slow. Nobody wants to put, and I hate to say it that way, but nobody wants to put the effort in to be the 1%er. Everybody thinks you should be in the 1% without busting your butt. Look at you. You built the magazine. How long did that take you? 2 weeks?
No, forever.
I know. Nobody sees the forevers. And guess what? See, the problem is I enjoy the journey. I'm having a cool run. This is really cool. This was a privilege to talk to you. It's the end of my day. It's the thing. It's exciting. So I get a kick out of all of this. And it's not the end product that's the destination. So if you don't want to, and today dentists do go out of business. I had a father-son team that the son had to move to Maryland, and the father sold the practice right up the block in HoHoKus, one of the wealthiest towns in Jersey.
So final question. We went way over an hour. Final question. There's a 40-year-old dentist listening to you. He's burned out, fried, and he's just burned out. What advice would you give him?
Rejuvenate yourself. Take a little time, if you have the money, regroup and think about it. Think about, see, dentists, we're the chief cook and bottle washer. You do the lab work, you have to, do, there isn't anything you don't do as the owner. So embrace that. If not, there's plenty other things than just doing tooth carpentry. There's education basis. Rutgers has a wonderful dental school. NYU's always got people to be, you could influence other people in that area. So you don't have, you can go into sales. I just did a consulting for a guy who left dentistry 10 years ago. He's probably not 50, and they're launching a new software company. So because we were trained in that box, doesn't mean you have to stay in that box. You could do whatever you want.
Well,
did you know you were going to own a magazine? Did you know you were going to be on TV?
Never.
How did you get there?
I mean, seriously?
Yeah.
I love dentistry more than anybody I knew, and I was reading these dental magazines. It's like, who writes this stuff? So I thought, well, you know what you do? I'm the problem. So I would write these articles, and I would submit them to JADA and all the other ones, and
Tony Angelini.
Yeah, and JADA published for them, but they didn't like him. So finally, I started meeting them, and I realized, oh my God, none of these dental magazines are owned by a dentist. It's all non-dentist, and I thought, you know what? Dentistry needs one magazine that's actually owned by a short, fat, bald, real dentist in Phoenix who's doing this. So I did it. And we started in 94. No one even knew who it was till we added Dental Town to it in 90, St. Patrick's Day, 99. So yeah, the first 5 years, I mean, it was very hard, but I did it selfishly for me. I wanted a better dental magazine.
Me too. Again, but what I'm saying is that the journey, you explored it. You didn't live in the cubicle. You saw the cubicle and said, I got to get out. And that's the cool part. We're educated. We're doctors. You got an education. You don't have to be in the cubicle your whole life. Get out and find out. Smell the flowers. Do stuff. I mean, I'm really right now, and we took this new associate because I really would want to do some more on the headaches and more on sleep and TMJ. I'm just too busy. So when we start to grow and I'll get a little of that time, I'm not going to take the time off. I'm going to take the time to do more cool stuff. How to help people.
Well, we are well over an hour, and Michael, seriously, it was an honor to podcast you. Thanks for coming on the show with me and sharing your wisdom from 4 decades of dentistry. And someday you and me are going to have a beer on Nantucket.
All right, you'll send. I'll send you the information how we do it, and we'll figure out
how much would we have to drink before we tried to swim to Martha's Vineyard from Nantucket.
You don't have to drink a lot. A case or 2 before in the morning, and then in the afternoon I'm actually starting a rum company.
Are you really?
I do. I have a rum company started with my son.
Wow. Well, I can't wait. I will see you on the beach.
All right. Listen, we'll keep communicating. I'll keep in touch with the Clear Choices Foundation. I'll let you know everything. We'll keep you posted on that.
Yeah, Clear Choice. You said starting the Arch of Hope Foundation.
Yeah, I'll get you. I'll see if Gina wants to reach out. Well, again, we're Straumann people. They're all done phenomenal. They're all really sharp people. They do their homework. And with the testimonies.
Okay.
In fact, you know what? Are you looking for other podcast guys?
Yeah. Why? Who are you thinking?
I could get you a guy from Clear Choice that you'd love.
Yeah, let's do it. Bring him in. You got my email, howard@dentaltown.com.
Yeah, he's a really sharp guy. He was president of Straumann, so really sharp guy, and he's easy to talk to and nice. All right, go have a beer. What time is it in Phoenix?
It is 1:15.
Jeez, it's 4:16. I'm past my bedtime. I'm 66, will you?
You're looking great. Thanks for coming on the show.
The other way. Thank you very much.
Bye.